Well, as you know, education is our top priority for this session, and I serve on K-12. Today, we had a lot of discussions about the assessments in our high schools. In fact, there was a group of students from Tyee High School that testified and did an incredible job. They were concerned because they are prepared to graduate, except there's a few that have not passed the biology exam. And they really feel like they did well in the class, but for whatever reason, they didn't feel like they tested well. And so we had a discussion of what that meant today. And you know, we want all our students to be successful, and these are students that are prepping to go on for college. So it's an issue that we're going to need to address. You know, I think we've all in agreement that the mental health system is broken, and it's going to take a lot of different steps to fix it. You know, I serve on judiciary where we're looking at the Involuntary Treatment Act, which is how people get into hospitals who may not want treatment. And so I've introduced bills, and a number of members have, that really are trying to improve that. People might have seen the Jones Law that passed recently, and that was two parents coming forward who lost their son in a huge tragedy where he really didn't get the help he needed for a variety of reasons. And so they put a bill forward to really address one of the issues about families really being able to weigh in when they know their family members are going down a path that they've seen before and are really dangerous to themselves or others. So we did pass that out of the House this week, and I'm really proud of that. I have a couple bills around the ITA. One is to expand less restrictive alternatives, and to make sure we're again weighing in the history that someone may have a prior hospitalization, and includes weighing in family recommendations. We also have a bill to kind of study different counties detain people differently, and someone might meet a threshold in one county and not another. There might be other ways through non-emergent detentions to bring people in that might be used in one county like King but not in Pierce County. So we need to understand what's going on. I'm really proud we're bringing a big team together this Wednesday, and we're going to talk about the system as far as the involuntary treatment and what we should be doing. Other fixes will be permanent support housing, more outpatient services, and there'll be a whole variety of things we could be doing to support people with mental illness. You know, I think there's a couple reasons why it should be at 21. The first is when you look at young smokers, like 12, 13, 14, they often get access from cigarettes through 18-year-olds. And of course, a fair number of 18-year-olds are still in our high school system, right? They're still getting their education in the K-12 system. So by making it an age like 21, that will reduce access for our younger smokers. The other reason I'm worried about it is 9 out of 10 adult smokers started in their teens. And I really don't want to set up these young adults for a life of addiction. It's highly addictive, nicotine, and we know that, and we know it causes incredible damage and health problems. So again, I think it's really trying to help our youth make healthier decisions.